Hi all, I am Dr. Kumar Parth. I am consultant surgical gastroenterologist practicing at Sagar Hospital, Banashankari. We'll discuss today with a very small topic called blood in stool, but it may be a nightmare for a patient. So first we should know that blood comes in the stool in two forms. It may be a fresh blood, it may be a occult blood, or it may be a black color stool, which we particularly call melena. So black color stool generally happen when you bleed in the stomach, upper part of the gastrointestinal system. Motion may have a frank blood when you have anything at the motion area. So, and it can be a occult blood where a patient doesn't see in the blood but his hemoglobin is dropped. When we check for the stool, we find microscopic red blood cells. So basically we'll discuss here the part where the patient sees a fresh blood in the stool. So there are two categories here. One is the bleeding is either with pain or it's a painless bleeding. So most common bleeding with pain happen only in two scenarios, where you have a tear in the anal canal, where the tear, same tear what happens in your lip, moment you pass a stool you feel pain, and that we termed as a fissure in ano, which is a quite treatable condition. 90% of the patient can be treated with medicine. Only 10% of the patient where it keep happening when the tear is very deep, or the anal sphincters which hold your motion, the inner sphincter which has become very tight, can be corrected by surgical, and it's a permanent cure. So second category comes piles. Generally piles are painless bleeding. So what is piles? It's just like anal cushions, the vessels which helps to sense your motion and distinguish between flatus and your motion. Everybody has got a piles, but sometimes it enlarges, and when you pass a hard motion it can get open up, and you feel, I mean, you see like you pass lot of blood in the motion. It's a drop blood, and it's a, I mean, profuse bleeding basically which happen in the piles. The only condition where piles can pain is a like thrombosis, where the blood clot happen in one of the piles vessel. We call external or internal thrombosed piles. Otherwise the bleeding when it is a painless, mostly it is a pile. Now there is a third category when there is a painless bleeding. In two condition, most common condition, as a because of general population I can't go in detail, but two condition where we keep seeing a painless bleeding. One is a ulcer. It can be a simple rectal ulcer, it can be a other category of ulcer, especially called ulcerative colitis and Crohn disease, or a non-specific ulcer. Unfortunately, I mean, it's very difficult to diagnose in the shortoscopy, where we, I mean, in piles and fissure we can diagnose in the OPD basis, where we put a small scope and we can see up to 5 centimeter where the piles and fissure remains. In case of this non-specific ulcer or distinguish between ulcerative colitis or Crohn disease, we need to do a colonoscopy. Is a video colonoscopy. It's just a 10-minute procedure where the patient, we put a scope and we see whole length of the colon and a small bowel, and we diagnose whether it's a ulcer related to colitis, or it may be a non-specific colitis, ulcerative colitis, or Crohn disease. The fourth category which we keep seeing blood in the motion is the cancer, colon or rectal cancer. Again, to distinguish between the colitis and cancer, we do colonoscopy again. So there is some distinguish between the colitis and cancer, where a patient in a cancer, generally there will be an alteration of bowel habit. I mean, sudden a patient who was normal, he will say like, I pass motion 3-4 times in the morning and I'm not able to clear it. So in those conditions, there may be a growth in the anal canal or in the rectum, or in the I mean your colon, especially sigmoid or any part of colon, where the motion, there is a blockage because of tumor. Motion comes and get accumulated above the tumor, above the growth, and it keeps sipping, and especially we term as a spurious diarrhea. So clinically 60-70% we can make out that what kind of bleeding it can be, but a basic scopy and colonoscopy can help to distinguish between all type of blood in the stool. Thanks a lot.